feels?
Terrible. And that's being honest. That's the words. That's the only word I can think.
Do you feel isolated?
I very much feel it. I feel it. Yeah, exactly. That's a word. That's one wording.
If you can describe in a couple of words how you feel with that personalised support that the volunteers and the third sector bring to you to support you going out and shopping.
Alive.
Alive. So you've gone from the isolated feeling of terrible to with that support feeling alive.
Yeah, all the time. That's how that's the way it makes you feel. Nobody see, nobody else. I'm just in here, and that's it. I see a person maybe twice a week, and the rest of the time, forget it.
Steve is a chap who's known to our service now for about a year. He's a 61-year-old gent who's had he's had 2 previous strokes, so he has aphasia. So he is his speech is delayed as a result of his stroke. So Steve was ringing one of our workers asking for help daily. What could we do to meet his needs? He was going out and about, and he was he was washing and dressing himself, self-sufficient in that respect. So one of our workers, Deb, who spent a lot of time with Steve, getting him more sociable and making him go to different places and actually showing him what is out there for him. She signposted him into the third sector and the voluntary agencies.
Because for the large part of the day Stephen can manage and it can manage self-sufficiently. 24-hour care or something like that is not an option really for Stephen, because he can manage in the community. He just needs that little bit of support, i.e. what the volunteers are currently doing at the moment. They're seeing him a couple of days a week for a couple of hours. They take him to the cafe, have a chat, find out the sort of things that he wants. It's just low-level support that Stephen needs, and without that he just finds himself in his room doing nothing, on his own, not coping. And that's where, when he can't cope, that's when the isolation and the loneliness comes in, because he doesn't know what he's doing. He just doesn't do anything.
We first came in contact with Stephen by referral through SSOTP, and a very proactive one of the social workers referred him in to us. And from that referral, we've been able to put in place a degree of support for Stephen to try and help him with his needs, basically. So that ranges from helping him go shopping each week, and to try and look at his eating habits, and try and get him to get some healthy foods basically that he can eat on a regular basis. And then it's a bit of befriending, so it's actually meeting him, having a cup of coffee, having a chat, and then other support as well involves actually Stephen helping us, because he actually comes to one of our cooking sessions and volunteers as such, and he's getting a bit of interaction then with other people, different people, as well as helping make teas and coffees, perhaps helping do some of the cooking.
It's them people in there that keep me going. They come once a week, and I keep listening and looking and whatever. But those are the only people that keep me going at the moment.
We have service users who come to us who don't have they have their capacity, they function, they go out and they do things, but actually their fundamental problem is that they are lonely. They have nobody. They may go to the shops or they may go and be self-sufficient, but they're actually lonely. They've got nobody to take care of them and to be involved in them.
I think the first thing to point out, I suppose, is we're all Stephens ultimately, because we through health or through circumstances, we could all be in a position where we're classed as socially isolated. So, and whereas perhaps a lot of people will have family, friends, perhaps know a bit about what's going on in their local community, not everybody does, and when you haven't got those networks in place, all of a sudden you find the world a very lonely place indeed. So we all potentially are Stephens, and I think and what that does, that affects your mental health, it affects your well-being. You become depressed, and and quite quickly your health can deteriorate. So the impact of loneliness is quite, can have quite a detrimental effect to somebody's health and well-being.
By having that opportunity with the volunteers in particular, because they can give him that time that he needs on a regular basis, he's able to express himself, which is meaning that he isn't as isolated, because he's got people in his life now that he didn't have before.
I met Steve with Miles Gilbert, his social worker, and when I first came out to meet him, Steve described the feeling of isolation as being terrible. They were his words. He says it just feels terrible. And I asked him how he felt when he was with people, when he was gaining that social interaction and that stimulation. And Steve described it as being alive. He said, I've gone from feeling terrible to feeling alive. And that was quite poignant, really.
Keeps me alive. Keeps looking, and something to look forward to. Without it, I've got nothing.
Something like the CISS project is a good thing, because it's another avenue that we can turn to, because you get someone like Stephen that, like I say, it's low-level support that he needs. So in a lot of sense, you could say he goes under the radar, or he doesn't fit into a said category. So it can be quite difficult for social care to find ways to support Stephen and other people like Stephen with dealing with isolation and loneliness. Someone like Stephen that suffers it on a daily basis, having the volunteers is enabling, Stephen to be his own person and do what he likes to do and what he wants to do.
I think the CISS project will strengthen the relationship between the statutory services and the voluntary sector, because what CISS will do is it will provide a referral pathway that voluntary sector groups will be able to get more referrals from. So therefore, more people who engage in the voluntary sector in a range of different activities that provides, and that could be through some of the befriending that we're delivering. It could be going to a local knit and natter group. It could be getting some advice and support on it's like in Stephen's case, some reading and writing, going to the reading buddies. So there's a whole wealth of groups that are out there, and I think ready for the challenge of being able to have that connection with the statutory services.
We have researched the links between physiological health and psychological health, and we've married those needs up to look at those isolated people who are at home are more at risk of going into hospital. And certainly I'm a nurse by background, and I've worked in hospitals, and we almost want to stop that person needing us. So it's about prevention, and the 5-year forward plan looks at prevention, looks at how to keep people safe and well within their own homes, and we very much believe that we should support this, and these people, they have needs that aren't being met, or if they are being met, they are either inappropriately or not personalised by the statutory services, and we want that personalised, individualised need to be met, so as to prevent them becoming unwell, really. So it's about prevention.
At the end of the day, what I'm trying to do is get people involved. What people, like me, hundreds of others, thousands of others, that are just sitting there, what should I do? What am I going to do for today? What am I going to look forward to? Without them, without people like that, I've nothing. I've got nothing. Without them, I've got nothing.